Ooh. I was just praying, just say, please God, gotta be someone out there that can help me.
Okay, brother. So I saw on your paperwork you had a bit of a rough one last night, right?
It's I get about three flares like that.
Yeah.
A day.
Now it's going up.
Okay.
Yeah.
So talk to me about it. Kind of start from the beginning and just tell me what's going on.
Okay, it's long, but I'm gonna just
Yeah.
straight to the point. For about 5 or 6 years, I always have a hard time on my left.
Mm-hmm.
I lifted a giant, heavy cooler.
Okay.
So when I lift the cooler, it was so heavy, it slanted all the way towards my right, and this right here, and that's when I heard like something like a pop.
Okay.
And I'm not kidding. I'm not making this up. I was paralyzed. Like I couldn't move. I was like this. I went through hell.
Yeah.
New symptoms like vertigo. My hands were shaking. I was taking a shower and I have to hold myself, and I was still shaking. Didn't know I was like seeing kind of like double vision.
Mm-hmm.
All this was like facial pain. From there, I was having a lot of nausea, GI problems. My heart was racing. So I was getting all these brand new symptoms. And of course, this was hurting me a lot next to my TMJ. So that happened, getting all those symptoms. I was going to the hospital literally, I'm not kidding, like about 2 or 3 times per day.
Yeah.
And this was like black and blue because every time I go to the ER, they always take blood and they repeat the same tests.
Yeah.
Even the GI was pulling his hair because he can't even figure out what is
What's
causing
going
my stomach here. I was going to see a college. I was all over the place.
Yeah.
So I was a little desperate. This was hurting me a lot. So I had Botox.
Yeah.
They put Botox here a lot. And then I find good PT in South Lake. I didn't even know how I made it over there because every time I drove my car, my hands were so shaking. And I was going there every single day. And every single day I was losing my balance. Like I was getting tons of vertigo. Even though I have less pain, but still all these symptoms was coming up.
All right.
The PT did help. He's a PT and also he's a chiropractor.
Okay.
But I just feel like he used this little machine, which I'm pretty sure you're familiar with. It's called the EMS. He was doing that like constantly every day. And actually they kind of help. So I don't know what did help. I don't know if it was the combination of both of the Botox or the EMS. I don't know.
Right.
I was still hurting here. And then I trusted this TMJ doctor. I put my hands. And he said that you need a little procedure because it's a little dislocated. So he did, push it back.
Surgically or with his hands?
No, surgically.
Okay.
Yeah. And from that point, when I was like almost getting to 70 to 80%, he took me to a negative 80%. Because from there, I had a lot of pain.
And it is common for you to have a disc issue on one side or to have something going wrong on one side that's creating a restriction. And your body trying to deal with that ends up being overactive on the other side. And so it's very common that patients come in with pain on the opposite side of where the dysfunction is. The problem is that any surgery, anytime we poke into you, anytime you do anything, you trigger an inflammation response, there's a scar tissue response. Sometimes we want that scar tissue response. Maybe they're trying to tighten up ligaments, things like that. But it's a new thing that you have to heal from. And so it's not that uncommon for these types of procedures to leave you feeling pretty rough afterwards. And then usually they have you follow up with like physical therapy and things like that.
Yeah. This has been like this for 3 years. Like, all this stomach, this. I just feel something is misaligned.
Right. Yeah.
And I get like this big muscle, like a little spasm right here from the underneath my atlas from C1 to C7. And it creates like a big knot right there on my tribe, right there. So I did the trigger injections. I did everything you name it. I did it.
Right.
The trigger injections, it helps less than 24 hours.
It comes back.
It comes back, and then I have to wait 2 more weeks
Yeah.
in pain to get the trigger injection again. The medication is just, I just feel like it's just like a little Band-Aid.
Right.
But I'm really trying to find, like, I know it's there, but
Yeah.
what is the root of the cause is triggering all these light bulbs?
Yeah. Unfortunately, what ends up happening is, Botox injections, these medicines, all that, they're trying to treat the muscle spasm. They're trying to treat the inflammation, right? But the question is, why is your body choosing to spasm those muscles? Why is your body choosing or needing to create inflammation, right? And so a lot of times it's like, if I have this muscle, it's being told by the brain that it needs to be contracted. And then I paralyze the muscle with Botox, right? I didn't change the signaling where the brain is sending the signal to spasm that muscle. It's the same thing with muscle relaxant medications. It's like, well, why is the body choosing that as a strategy? So your body is a very smart machine, and it's trying to adapt to what's happened to it. And some of the strategies it's using is muscle tension. Some of those strategies are not working to get the effect that it's trying to have. And so what we can do is we can go in there and find those areas that are not moving the way that they should. We can stimulate the brain. We can stop that reflex where it's telling you to use a muscle spasm and a stiffness strategy. And then that muscle spasm is no longer, the signal is not coming from the brain anymore. And so rather than treating the muscle spasm, trying to get it to stop, we treat the underlying issue, which is that your body is trying to use spasm to do something, but it's not being successful, right? Because if it was successful, this happens a lot with ribs. You throw a rib out, your back spasms up, and then you move a certain way, and because your muscles are so tight, the rib clicks, and then it all relaxes, right? Your body's successful. But sometimes you have situations like this where your body's not successful and repositioning you or doing what it's trying to do. So I want to ask a couple of clarifying questions and then go through. So you've always had some general stiffness, achiness, pain for like the last 6 years on the left side.
Correct.
Is that correct?
Yes, sir.
3 years ago, you're lifting up this heavy object, you shift weird, then you have this whole episode.
Correct.
Everything gets worse, vertigo, spinning, pain, numbness, tingling in the arm. You go to the hospital, and I assume when you went there and you told them about the vertigo, this stuff, they did like a brain scan. They thought you might be having a stroke or anything like that.
Yeah, they did a bunch of MRIs, a bunch of CT with contrast.
Correct.
And
everything came back normal.
like always.
Okay.
Like,
So then you go to the cardiologist. He does all his tests, and he says
I did,
everything's
and I did the
normal.
stress. It's called the stress test.
Stress test, yeah.
I did that.
And they said everything's normal.
Normal.
Blood work's normal.
Yeah.
You go to the GI doctor, normal.
Normal.
Right, so everyone, all the specialists are doing all the scans, all the tests, they're telling you
Yeah.
everything's normal.
Yeah.
Okay. So I know that is, annoying and it's a pain in the ass, right?
Yeah.
But the benefit is I actually like when patients come into me in this scenario because you've had all the experts do all the scans and all the tests and say that everything's normal, so we know you're not having a stroke, you're not having cardiac issues, you're not having GI issues, which means the likelihood that it is something that chiropractic can help with, it's actually the joints, placing your system in a state of stress is pretty high. So that's what we want to look at and see what's going on there now.
Yeah. I'm trying to be patient right now. I'm just holding the pain that I have right now.
Yeah.
He gets we
Migraines?
don't know if
Yeah, I
the
get-
headaches.
I
Like he
get-
was going to the hospital a lot for left-sided headaches. So he has been diagnosed by a neurologist with cluster headaches.
Yep.
But
I just
again,
feel
his
behind,
question is, why am I getting cluster headaches?
and behind this eye, I just feel like there's like a little tiny little person just
Stabbing you,
stabbing me and pulling. It's like a rope.
pulling on your eye.
Yeah, and just like little jabby needles like over here, like
Yeah.
Yes.
Yeah, and the thing is, the longer that you're in pain, the more your system kind of gets sensitized. So everything starts, it's like someone slowly turning up the volume knob because your brain gets used to this pain pathway. Okay, so we want to take a look and see what's going on. Now, today, are you having any double vision or anything like that?
Yeah, I love it
Double
right
vision.
now. Look,
Yeah, I see that. Okay.
It's watery and it's
Yeah. You're feeling with the eyes watering. Yeah. Okay, let me have you put your glasses on for me for just a second.
yeah.
And then you're just going to follow the tip of my finger with your eyes, okay? Okay, and I'm going to come towards you.
Ooh.
Yeah, so you're losing it a bit there.
Yeah.
Yeah, okay. All right, doing okay?
Yeah, that's weird.
Let me have you raise your eyebrows like you're surprised, and then frown like you're angry. Yep, puff your cheeks out, and then don't let me squish them. Okay, smile real big, and then frown. Okay, wrinkle up your nose. Good. Okay, now let me have you just hold your arms out for me, just like this. Don't let me push them down. Okay, we're pretty weak. There.
I know.
Is it painful?
It is pain a lot.
Yeah. Okay. And then what I want you to do, go ahead and just stand up for me right here.
Sure. Facing.
Yeah,
this
right there is fine.
Okay.
And then you're just going to march in place for a second with your eyes closed.
March.
Yep.
Going forward, right?
No, you're just going to stay in place and just kind of lift your legs.
Oh, okay. Got it. Like this, right?
Yes.
Got it.
And then set it down. And then the other one. Good. And then set it down. And now I just want you to stand here with your eyes closed for a second. Okay. And then you can have a seat again for me. Doing okay there?
Yeah, it's hard to.
A little bit of dizziness.
Yeah,
and
to
everything.
keep my balance.
Okay. And then I'm going to take those glasses from you, and we're going to take a look at your neck here, okay?
Sure.
If I do anything that makes you super, super dizzy or anything like that, you just let me know, okay?
Yeah.
All right. When you were seeing the physical therapist,
Wow, right there. Every time
painful.
You have no idea how painful that is.
When you were seeing the physical therapist, how long ago was that?
I just saw him actually yesterday.
Okay. And has he done any like cracking of your neck or anything like that?
No.
Okay. Have you ever had your neck cracked?
Yes.
And have you had it cracked since this happened?
Yeah.
No,
What?
he had
No.
an adjustment by an upper cervical
Yes.
chiropractor, but it was like very gentle.
I'm pretty sure you heard of the word Blair.
Yeah. Blair technique.
Yeah. I don't know what happened, but when he did that Blair technique, wow, it took me to another universe.
In a good way or a bad way?
No, a bad way.
A bad way.
A bad way. My hands were sweaty, my feet were sweaty. I was like constantly shaking, like constantly.
Yeah. How long ago was this?
Like 2 weeks ago.
2 weeks ago.
Yeah, and he ordered the. I paid for it. It's called the DMX. I'm pretty sure you heard of it.
Mm-hmm.
It's like a 3-day thing.
3D scan?
Yeah.
What did that show?
Do I have it in my?
Yeah, that the atlas was a little off, but I think it was like 1 point something. I don't
Yeah.
even know if they measure by milliliters.
Yeah, they're always very small.
It was very small, but he said that even with something that small, he could be experiencing symptoms.
Yeah,
I
this
don't-
is very common for upper cervical type stuff,
Yeah.
especially when it's severe. So your right occiput, where your skull joins the atlas, is super stuck, super stuck. Now, what I'm wondering though is, are you interested in doing an adjustment to clear the joint? Because I know you had kind of a bad experience with that last time.
I'm putting my faith in you.
Faith in me. Okay.
I'm just gonna put my faith in you.
Okay.
I'm gonna. That's it. That's it.
I want to do one thing here real quick. If I press down on you,
Oh, that hurts.
Yeah,
That's
he's
worse.
had that
Yeah, like
experience
right,
before.
right.
all through there.
Like 1 through 4.
Okay. And what about if I lift up?
No.
Does that feel better?
Yeah.
Okay. All right. Okay, brother. So we're going to hit this occiput because this is huge for the vertigo, the spinning, and everything that you're talking about. So I'm going to hop up here, and we're just going to walk you through this slowly, okay?
Yeah.
So let's have you lean back on my leg here. Good. So I'm going to position you just like this. Does that feel okay there?
Mm-hmm.
Okay. My hand's going to go right here. Good. And it's going to be kind of a quick movement. Okay. Take a second.
I don't know what I'm cheering.
That's okay. What do we think?
Yeah.
Yeah.
Felt good on this side.
It didn't feel bad like the other?
No.
Okay. Okay. Let's take a look at this left side now. Doing okay.
Yeah. This is like the.
Yeah, I feel all through this.
The worst.
Okay, brother. So we're going to adjust through here. And I'm just going to take it as easy as I can on you, okay?
Yeah.
Let's have you lean back. We're going to lean a little bit. Okay. Good. Try and let this just fall. Yeah.
Ooh.
You have a tissue? There you go. What are we feeling?
Still feels a little bit of like
Some soreness?
a little tightness.
Yeah.
Like
We need to work through all the rest of this.
So 1 and 2.
Yeah. Now, does that feel okay, though? You don't feel like that felt bad?
No.
Yeah.
No. Oh.
Okay. All right, let's have you lay on your back. We're going to start working through some rest of this, okay?
Okay.
Yeah. And you just lay back for me. Perfect. Big breath. One more.
Oh.
Okay. I'm going to do one more.
Oh, good.
Right here. Good. Okay. Couple breaths.
Yeah.
Doing okay?
Yeah.
Let's scoot you way up here.
So funny, like on that T number is they went straight to SC1.
All the way up.
Yeah. What do you want me to do now?
You scoot up here towards me.
Okay.
Perfect.
What?
Yeah,
This?
right there. So.
Okay.
Okay. All right, and then let's take a look at your jaw. So, open for me. Yeah, we got arthritis. I can feel the grinding. Open. Close. Open. Close. Yeah, we got a lot of deviations and stuff. I just let that hang slack for me. Yeah. So we're really stuck on this right side. And I think that's putting a lot of... Basically, the left side's trying to make up for the fact that the right side's not moving well. And that's why this is degenerating faster than the other side. Now, the good news is that this joint is different than all the other joints in your body. It's lined with fibrocartilage instead of hyaline cartilage, which means that the degeneration does actually have some ability to heal and regenerate, especially at the joint level. Not so much at the bone level, but at the joint level. So you actually have, if we can get the stress off this jaw, in the long run, you can actually heal and have that cartilage integrity improve and the quality of the cartilage improve. So it's one of the reasons, I mean, obviously, if you can't use your jaw as an animal, you're going to die, right? Because you have to be able to eat, talk, everything. So because of that, the way God made us, this joint actually responds a lot better and can heal a lot better than other joints in your body. So I would like to adjust the right side of your jaw if you're comfortable with it.
Yeah.
Okay. So what I'm going to do is I'm going to turn you to the side here. Just like this.
Okay.
Is that okay for you?
Yeah.
Okay. And then you want to have that jaw as loose as you can. I'm going to come in right in here. And it's going to be kind of a quick movement. A little bit slippery here, so let me dry you. Okay. Grab a tissue. There we go. Just because I don't want to slip. Okay.
Let's hang it, right?
Yep, right here, just loose as you can. Oh, good. Doing okay.
Yeah.
Open, close, open, close, and then relax, just loose. Feels a little better.
Yeah. Yeah. Mm-hmm.
Yeah.
Yeah, I can open my mouth a little bit more.
Yeah. I think we're going to leave the left side alone because it's moving a little bit more than it should. It's trying to make up for this.
Okay.
This feels a lot better.
Okay.
We're going to see how your body balances that
Okay.
over time, and then we'll keep checking on this.
Okay.
There may come a time where we're going to adjust both sides, but for today, this is good.
Okay.
And then I would like to decompress you if you're all right with it.
Yeah.
Where we're going to put a towel around you
Okay.
and pull. Okay.
Okay.
It seems way crazier than it feels. Okay. So
Pull on his neck.
yeah. So this is going to look like it would feel terrible, but it actually feels pretty good. So, okay. What I'm going to do is I'm going to put a little weight on your hips here just to help keep you still.
A little weight.
A little bit.
That's more than a little.
It's about 60 pounds. Okay. And we'll have you lift your head. Good, and then set it down. So I'm going to wrap this around you, okay?
Okay.
I'm going to give you a slow pull. You're going to feel kind of a bit of a stretch and decompression. And I'm going to give you a
Okay.
short little quick pull. And that's going to decompress your spine.
Okay.
You just want to make sure your teeth are touching so you don't bite your tongue or anything.
Oh, okay. And what about my hands?
Right there is fine.
Oh, you just leave it like this?
Yeah, just like that.
Okay.
So you're just going to breathe in and out through your nose. Just try and stay as loose as you can.
Ooh.
Doing okay? All right. Kind of intense, huh?
Yeah.
How do we feel?
Good, good, good.
Yeah.
I just felt it like
All the way down.
all the
right?
way from the L to the T to the C.
Yeah. Yeah. It kind of opens things up. Yeah. Do you need another tissue?
No, I think I'm fine.
Okay.
I think I'm just fine.
Yeah.
I just feel
Processing.
yes, processing.
Yeah.
It just feels good. Feels good.
Good. Good, good.
Feel a little less eye pressure too.
Yeah. You're going to feel this all start to kind of slowly calm down. Yeah.
Oh God.
What do you think?
Huh?
What do you think?
Good, good. I'm just trying to hold all my emotions.
Yeah. You can let it out, brother.
No, I don't want.
Yeah.
It's like people don't understand what I went through.
To be in pain for that long.
Yeah, being in pain. And
And all the
It
doctor's
was
visits and everything.
it's constant.
Yeah.
It's not like I wish it was like every 5 hours or 10 hours. No, it's like every second.
Yeah.
And I constantly come to the doctors. It's like people think like I'm cuckoo. Like
No.
I was just
Yeah.
making it up.
You're not crazy.
It's just like
It's hard. But I want you to know that you're not crazy, right? These symptoms, the vertigo, the dizziness, the numbness, the pain, the headaches, the GI stuff, all
Yeah.
of that is normal when we have something like this going on, especially with that upper cervical spine. You can get
Yeah.
all kinds of weird symptoms, and I get patients in here all the time that have done the same thing as you. You know, they've seen all the doctors, all the specialists, all the tests, all the scans, all the blood work, everything's coming back negative. And so the doctors are, I guess, frustrated, right? And it's like, well, you're not making it up. It's not your fault, right? You're experiencing this.
yeah, exactly. Yeah,
So.
yeah. Just I mean, just experiencing it, and when your body is so much inflamed and it's in a lot of pain,
Yeah.
Of course you're gonna have a little bit of like shakiness and
Yeah.
stuff like that. It's just like I just dislike when doctor sees me that even the paramedics, because I do call 911.
Yeah.
And the first perception, they say, oh no, this guy is suffering from
Anxiety or panic attack. Yeah. You don't come across that way. You come across as someone who's in pain and you're looking for answers.
Yeah, and a lot of times I'm just trying to hold my pain and not to shake so much because, again, because of that perception.
What people are going to see and what people are going to think.
And I will say, well, get rid of the pain, and I promise you, I will stop shaking. Yeah. It just. But thank you.
Of course.
So much.
I'm going to help you up here. So what we're going to do?
Oh, there you go.
All right, you don't even need any help. Okay. Let's have you move around a little bit. Just see how that feels through the neck, upper back, and everything.
Oh wow.
Yeah.
Feels not too tight.
Yeah.
I feel a little loose.
Looser.
Yeah, feels great. It feels good.
Are we still having as much of the kind of spinning sensation?
Not too much. I can still there, but I know
it's fading.
It's gonna diminish.
Yeah.
Little by little. But the most important thing, it feels good. Like
Move.
going like this, like, because all this, like, I didn't know if it was my Vegas. I don't know if it was my SCM muscle. I don't. I don't know.
All those nerves, they all kind of come together. So especially there's an area in your spinal cord called the trigeminal cervical nucleus, and it receives...
Oh, the TCM.
Yeah. So it receives information from the neck, the upper cervical spine. It receives information from the face and the jaw.
Yes.
And also in that same area, you also have the vagus nerve, the accessory nerve, which goes to the SCM and the trap.
Yeah.
So all of these nerves come together there, and then they finish by going up to the brain. And so all these little things can start to add together at that area. And especially the longer it goes on, your brain starts to not get as good at telling what's coming from where. So maybe when you first got hurt, it's like, oh, it's coming from the shoulder. But the longer the pain goes on, it starts to kind of spread because the nerves aren't sure exactly where. So now it feels like it's in your jaw, and it's in your head, and it's behind your eye, and it's in the shoulder.
Yes.
And the longer that goes on, the more kind of spread out it gets. And then, it gets more confusing for doctors when you're trying to straighten them, because when we think about it, like, well, this nerve goes here, this nerve goes here, but they forget that it all goes to one place before it goes up to the brain. So I want you to know that what you're experiencing is normal, and that you're not crazy. And
No. Having all these crazy symptoms, it just took. It's hard because you have to train your mind so much, and your mindset is here, but the pain is here. It's like it's going
trying just to function,
and it's so hard.
Yeah.
Especially dealing with the pain.
Yeah.
But feels good. Feels nice. I can go like this.
Feel some relief.
It feels a lot of relief, and it's so funny because now I have to feel like it's like a little loose.
Yeah.
It's not too much.
Feel like just completely stiff.
Stiff, like spasm or anything like that.
And that's the goal, is we want to start to get the jaw to stop spasming, the neck to stop spasming, get all this inflammation to go down. And you're going to notice that the vertigo, the spinning, and all these symptoms start to reduce as we keep working on you.
Okay. So, I always tell each specialist, so doctor, but what is the root of the cause? Why I'm having this? And they can never give me a straight answer. They just go like
around it.
Get around it.
Yeah, that phenomena that I told you about the nerves coming together, that's the reason. All right, so you're getting this cross-sensitization of all these different areas. You're getting this expanding pain field. And so as we start to work through some of these areas that put input into that, it's going to start to calm that region down.
Wow.
Feel good, right?
Feel loose.
Yeah. And you're going to continue to feel better. So throughout the rest of the day, this is going to start to settle down. I would expect you to feel even better tonight and tomorrow than you do right in this moment.
Yeah.
Yeah.
It's like, just continue fighting. I've been in this journey for like 3 years, like I said. And the only thing I would just pray. I would just pray. Just say, please, God, gotta be someone out there that can help me. Oh, it's just like, and I lost my mom. Like, My mom passed away like about 2 or 3 months ago. 2 months ago. So I
So
just
sorry.
yeah, thanks.
That's a
So
lot.
you know, so I'm just like just a lot of stuff going on, and a lot of times I wanted to give up, but I can't, and I was just like, I cannot tap out.
No.
I can't.
You're doing
Can
great,
I?
brother. No, you can't. We're gonna help you. Okay.
I appreciate it.
Absolutely.
Thank you.
We're gonna fix you up.
Thank
You got to stick around for all of us. Okay.
Yeah.